The medical aid group Doctors Without Borders is working in the Republic of Congo to eradicate sleeping sickness by finding patients who are not even aware they have the disease. The group has set up mobile labs in rural areas to test people for the parasitic infection carried by the tsetse fly. In its early phase, sleeping sickness may go unnoticed, causing only fevers or headaches. Once the parasite infects the brain, it becomes much harder to treat and can be fatal. The campaign also aims to educate the population about the disease. Sleeping sickness or human African trypanosomiasis is one of several so-called neglected tropical diseases. Amia Phillips, who tested positive, is now receiving treatment for early-stage sleeping sickness.
I can go to sleep at 9 in the morning and wake up at 6 in the evening. On some days, I can sleep at 10 in the morning until 5 in the afternoon. And sometimes I can sleep at midday and wake up at 10 or 11 p.m. and cannot go back to sleep.
Au départ, les gens croyaient que c'était un tabou, c'était les oncles, c'était les parents.
At the beginning, people thought of the disease as taboo and associated it with witchcraft. But when we began the sensitizing campaign and started treating people, they realized that they were just suffering from sleeping sickness. Some people had become crazy because they did not know what they were suffering from, but we managed to treat them. Since then, people are coming from all over the country to seek treatment and no longer believe that it's associated to witchcraft.
Le côté sorcier s'écarte.
And as sleeping sickness progresses, the victims become withdrawn, unresponsive, or overactive. This stage is often misdiagnosed as dementia. Now, sleeping sickness is part of the so-called neglected tropical diseases, or NTDs, a group of chronic disabling infections affecting more than 1 billion people worldwide. For many years, the Carter Center has worked to tackle NTDs, such as trachoma, in Africa and other parts of the world. Joining us on the phone from Atlanta, Georgia, to tell us more is Dr. Paul Emerson, Director of Trachoma Control Program with the Carter Center and Chair of the International Coalition for Trachoma Control. Dr. Emerson, welcome to In Focus.
Hi, how are you?
I'm good, thank you. Thank you for joining us. First off, can you explain to us what is trachoma?
Trachoma is an eye disease caused by a bacteria and can lead to blindness. And it leads to blindness in the most painful and miserable way possible that you can think of, because it causes the eyelashes themselves to rotate around and scratch against the cornea, physically abrading the cornea and leading to irreversible blindness.
Who is most at risk? Where do we find this disease?
It used to be worldwide, but it's now very much restricted to dry and dusty parts of the world. In particular, in the African region, there are probably 200 to 250 million people who are living in areas where they're at risk of blinding trachoma, and there are probably somewhere in the region of 3 million Africans who already have severe blinding trachoma.
The Carter Center is assisting countries in fighting this disease. Tell us about the mechanism. How does it work on the ground?
I mentioned that trachoma is caused by a bacteria, and that's good news because we can treat bacteria with antibiotics. And the Pfizer company based in New York donate tens of millions of doses of antibiotic to control trachoma. But that is part of an integrated strategy aimed at controlling the severe disease with surgery, operating people's eyelids, and then controlling the transmission with the antibiotics, with facial cleanliness, that's hygiene promotion, and with environmental improvements, that's sanitation and promoting water. And one of the big things about such an integrated strategy, that although it's aimed at one NTD, trachoma, it actually helps take care of a lot of other health issues in the affected community through the antibiotics and the hygiene promotion and the sanitation and water.
There have been reports of progress made in the fight against trachoma. Tell us quickly how you measure progress on what has improved.
At the global level, we are interested in the number of people operated, and that's over 900,000 people have been operated since the global program started in 1997. So that's almost 1 million people who have been saved from immediate blindness. So that's great news. In addition, more than 250 million doses of antibiotic have been distributed, which is great news. At the larger level, there are entire countries now that are considering themselves to be free of blinding trachoma because of the work that they've done to eliminate the disease. And I'm thinking specifically of Ghana and the Gambia in Africa, and then some Middle Eastern countries, Oman and Iran.
Wonderful. Dr. Emerson, we appreciate you giving us a better understanding of trachoma.
Thank you.
Our thanks to Dr. Paul Emerson, Director of the Trachoma Control Program with the Carter Center and Chair of the International Coalition for Trachoma Control, for speaking with us today on In Focus. Jimiaki, back to you.
Thanks, Linord, and we appreciate you always giving us updated health information. Linord Moudou joins us twice weekly with health updates every Tuesday and Thursday right here on In Focus.